Well, hello everybody. I'd like to introduce you to a very special guest. Today we'll be talking about energy medicine and the power of this medicine. This is the future of medicine we're talking about. And, you know, we often use bottom-up approaches in naturopathic healing. Biochemistry considers the physiology, but this is an integrative approach that also considers the top-down, you know, these incredible technologies that help rejuvenate the body and by introducing energy into the system. So this is an incredible missing link, I feel, to many people's practices and something essential for us all to know about as we move into the future and the science and technology grow together and expanding our understanding of bioenergetic medicine. So I'm going to introduce our speaker today. This is Dr. Donese Worden. She's an Arizona-based physician and global health educator. She's renowned for identifying and helping to bring unique healing modalities and therapies from abroad to the United States, putting her on the vanguard of integrative naturopathic medicine. She lectures for hospitals, universities, corporations, and the general public. She has 2 medical clinics in Arizona and located in Scottsdale and Mesa, Worden Medical Specialties. And for almost a decade, she has been helping clients achieve optimal health and energy using natural therapies. Her goal is to apply these leading-edge therapies to everyday practice that treat the root of the patient's concern. She's also a leading expert in regenerative injection technologies, therapies, and bioenergetic medicine. She uses scalar, biomodulator, Mandel color puncture, cold laser, music, and other frequency modalities. There's a lot of amazing technologies out there that this is essential we're exposed to as students. So designations include Diplomat, American Academy of Pain Management, member of the Consortium to Advance Integrative Healing and Wellness, member board of directors of both the Naturopathic Academy of Therapeutic Injections and the Naturopathic Physicians Board of Aesthetic Medicine, American Association of Naturopathic Physicians, Arizona Naturopathic Medical Association, ASU adjunct faculty, and an integrative medicine department. Also the International Who's Who of Women Business Owners. Member National Association of Women Business Owners and E-Women, summa cum laude graduate of SCNM, and she's also beginning production of a national weekly television show. So let's all welcome Dr. Worden.
Thank you, Stefan.
Thank you.
Thank you. All right, well, we're casual today. So, and I do want to open up for questions. You know, we've got a smaller group, and that's great. I like that. Yeah, we were on a scene. I can't move because the camera's set on me. You get to move. I want to see you. Thank you. So when the Naturopathic Society asked me to come and talk to you today about, you know, an upcoming workshop that we may want to do on frequency medicine, I was excited about it because I know that you're not getting it in school. And as Stefan said, I do believe it is an integral part. It will be the way of the future. We're going to see more and more of it, and I feel that naturopaths should be leading the way. Look at our tenets. First, do no harm. Use nature. All the things that we believe in and we do. And we're so busy sometimes trying to be real doctors that we forget about some of the best medicine that we still have is more natural, and it activates the body to heal itself. And I think we need to get back to those roots and looking at that. And it's interesting that the roots of natural medicine is taking us into the high technology, far beyond the other things that we're studying in school. And I always say you got to get out of school to learn anything, and that's true. You guys are in school, you need to learn what you need to learn, but as soon as you get out, you learn a lot more. So I'm excited to bring to you and let you know kind of my path of what I've done and why I gravitated toward this systems of medicine. Hi, come on in. So when I graduated, I've been practicing for over a decade, and when I graduated, I went into a pain management group. Desert Pain Institute, had 5 anesthesiologists there. They brought me on as a naturopath with at the time, very, very good salary. Naturopaths hadn't seen that kind of money. That was great. But I believed in me too, so I said, I don't want to just take a salary. I want a percentage of what I do. And they thought, well, you know, what do you do? Still weren't quite sure what a naturopath was. I had just been interning with actually a couple of the doctors there. So they knew me, and they wanted me on board for natural pain management options for these patients. So when I went in, within a year, I had outgrown my space. I had been brought back in and said, you're making too much money with the commission part. We want to cut you back on salary. And I said, let me get this straight. I'm making more money and making you more money than you thought, so now You want to cut that back. So it was a good problem to have. I still refer back and forth to that facility, just a couple of doctors there that I know real well, and they refer to me as well. But pain management brought me into the arena of looking for what is there out there beyond what we're doing and what we can do. Natural anti-inflammatories, regenerative injections. I started studying that, and I did that even in school. I was on the Naturopathic Academy of Therapeutic Injections, and for a while, and that was, those of you who probably don't know, you guys are young in school, Dr. Rick Marinelli was probably our greatest leader in naturopathic medicine for regenerative injections, for Prolo, for platelet, and Rick was a friend and a colleague, and that was our group. There were 6 of us that taught all over the country. We're teaching naturopaths, MDs, and DOs in these types of injections, therapeutic injections. We called it regenerative injection. It wasn't just Prolo. It became platelet, and then it became, using natural anti-inflammatories, those kinds of things. So I loved the needle, and in school, I was the needle queen, love needles. So then all of a sudden, and I got great results, even at Desert Pain Institute in pain management with the needling. I studied in France and I studied in Italy for periods of time with mesotherapy and neural therapy, the real way to do it, the way that they're doing it in Europe. And so whenever I studied with those docs and brought it back, you can't study with those docs in pain management and not say, wow, this works really well for aesthetics as well. So that's where pain management and aesthetics came in. And those are 2 great areas of medicine, and those are areas where things are needed. So I had my foot in the door doing natural injections and doing all the other things that we do as naturopaths, specializing, not saying I specialized in pain management, but I became a diplomate. Rick Marinelli, again, was the first naturopath to ever be let into that group at all, to be let in. Once he got in, he got the rest of us in, and we took the test, and they thought, they're not going to be able to pass this big, thick book. It's about corticosteroids, about the epidurals, things that you're not learning and not going to learn in school. We studied hard, and all of us passed with flying colors, so we represented the naturopaths well. Then we went into the DO groups and so forth, and the injection groups that said naturopaths should not be injecting. They don't teach enough of it in school, and you shouldn't be doing it. So we broke our way in. We said, let us in, we'll show you. And there was our group of 6 of us. And we went into one of the groups, and the funniest story that I tell is that we were with, I won't name his name, but he's a Russian doc, one of the leaders in all of this, that said naturopaths shouldn't be injecting. This has probably been about, 8 years ago or so. And we were under a fluoroscope under cadavers. So under the fluoroscope, you're seeing exactly where that needle is, right? So he was getting he had all the MDs and DOs, and they were just blind, sticking the cadaver, thinking they didn't know how to palpate. They weren't used to touching things like we're taught. So they're doing this, they're looking under the fluoroscope, doing this with a needle, and we would, our whole group, we would palpate, we knew where we were, one shot, be dead on. So it was getting to be, everybody was like, wow, these guys are really, really good. So it got to the point where it was getting, obvious to everybody. And so finally, I might as well say it, Felix, I did one of mine, and he took he had the fluoroscope off, and it was a cervical. And he said, no, you're in the wrong place. And I said, thank you very much. I'd like the fluoroscope, because I knew I was dead on. And I said, I'd like the fluoroscope to see where my mistake is, because I knew better to argue with him. So I'd like to see where my mistake is, where I actually am. So he put the fluoroscope on, I was dead on. So then he was like, okay, so after that, Felix became a fan of naturopaths and said they do know how to inject. We did because we'd been studying outside. It wasn't because we learned in school. I don't think you guys get enough in school. I don't. But so we became quite well known in the MD-DO world as these naturopaths that were very good at what they did with these injections. So here I am in the needle world doing all of this, and then realizing there was only so far with certain patients that I could get them with the needling, no matter how good we were and how good the medicine was that we were doing. And that's where I started looking farther into what I had been exposed to, even when I was in schools, cold laser at the time. My mother had a physician mistake, a physician-induced stroke, and so I was quickly jumped into the cold laser world with a chiropractor that we were working with. So I knew what it had done in stroke and neurological damage. I knew what could be done with frequency medicine. I'd been working with it for a while. So then I started, and the day I graduated, I had a cold laser at Desert Pain Institute. So I was always using that with the injections. But with cold laser, and again, as good as it is, there's only so far it can take you. You had specific frequencies. You had to be very knowledgeable, know which frequencies you wanted to be using, for what amount of time, what distance to the body. There's a lot of things there that we don't know. And I studied the Russian technologies and the Russian research to understand what frequencies I was using and why. But that was far beyond what you normally get taught with cold lasers and what you learn. So as through the years of utilizing that and then running into the Russian technology called scanar, I knew that it was faster, it was better, it seemed to be smarter at reading the body. So it's a real-time readout of what's happening in the body. Is it a training? Is the nervous system in training with the correct signals? With cold laser, I was good at it, very good at it, but I would have, the problem was the reproducibility with other practitioners. I was at that point allowing some of the residents to come in and work with me, and they'd say, I'm using the same protocol you're using, I'm using the cold laser, and I'm not getting the same results that I'm seeing you getting with your patients. So part of it was intention. I would say, what are you thinking about when you're putting the laser on that patient? You're thinking about lunch, the fight you had with your boyfriend or your girlfriend. What are you thinking about? I'm visualizing exactly what I want to go on in that body, and I had myself and that patient in that state. And so when you work with frequency, when you work with these kinds of energies, you will get better results. If you're really present, if you're using intention, which is powerful, and I'll talk about that a little bit and get more in depth on the workshop. But that intention piece is huge, and it works with your needling, it works with everything. You will get better results when you have that mindset there, but especially when you're working with frequency in bioenergetic medicine. So, worked with the scanar, and then as with any technology, there's always the new kid on the block, something coming along that does better. Now, to date, the best that I have found that I like working with is the Tenant biomodulator. It is scanar technology, but Texas Instruments got a hold of the Russian technology, reverse engineered it, put in some new cool things, and made it easier to use. Because it used to be with scanar, I had to map the body and put in the numbers, and I studied with the Russians on that, and the Australians. My teacher was very, very good. But it would take, if you did it right, a good hour per patient, and to charge what I needed to charge the patient to do that was not going to work, didn't work real well in the practice. I used it on the chronic patients, that was the only thing that I knew was going to work with them. But the newer technologies are faster, easier, better. It tells you when you're done. Not me, okay, I think I'm done, I'm not sure if I'm done, I hope I'm done. So the technologies have gotten very easy to use, and they've gotten less expensive, which is great. The cold lasers are still, to get a really good cold laser to be able to put in a frequency, is about $18,000. Now the new technology is about $2,500, and that includes 4 days of training. So I'm always valuing, what does something cost? For practitioners and for me, how much that means, how much I have to charge the patient. And I have a lot of cold lasers still sitting in my clinic. I love them, but we've gone beyond it. So I hope in the workshop I would get a lot more in detail about these things. I studied color therapy, the Peter Mandel system. It works very, very well for emotional things. But once you learn the other technologies, they work there as well. So I don't get out my color puncture much anymore, but if you gravitate toward those kinds of things, if you love it, if that's where your energy is, then you're going to have great results with it. And I did for a long period of time. But again, it took a little longer. I didn't get as quick or as fast a results, but still, once in a while, when I get a certain patient in, and I know that it's got a deep, deep emotional basis going on with their pain, or their whatever process that they've got going on, I'll still pull that color therapy out. Neural therapy, the scar injection is still a very, very valuable thing to be able to do. You can get to that with the devices. They just take longer. Whenever I can just get a needle out, do a quick procaine injection, get that going across the scar. So I still use scar therapy quite a bit. And then when you use the bioenergetic frequencies and devices, it really, really works because you don't have any blockages there. And those are the things that you learn when you learn from the masters and how to do this. I studied with Dietrich Klinghardt, and I would tell any of you that if you had the ability to do so. Now, I studied with him when he still was doing really a lot of pain management. That's who taught me neural therapy, Prolol, the Frankenhauser injections. No one at the school was doing any of that, the apitherapy, the bee venom injections. No one when I was in school was doing that. I was studying with Dietrich on weekends and during breaks when I was in medical school. I was coming back and teaching my teachers, Leslie Axelrod, all those guys. I was coming back, Dr. Tom Cruzel, and showing them what I'd learned. So what little bit you guys are getting in school was from that basis of me coming back and having open-minded teachers to say, okay, show me what you just learned. But I give credence to who I learned from, and that was Dietrich Klinghardt. He's gone more off into emotional, esoteric, past life things, so he's kind of progressed and got tired of pain management himself. But I would say the beginning things that he teaches still, the injections and so forth, would be very valuable for you, and he's into frequency medicine and understands the frequency and utilizes a lot of the things in his practice as well. But he's gotten where he's not using so many of the devices, he's using him. And so that's a whole another ball game of frequency medicine that we can talk about. Yeah.
What doctor is that?
Dietrich Klinghardt. He's in Germany half the year at the teaching hospitals there doing research, and then he's in Washington, in Bellevue, Washington, the other half. He has some great workshops still. I would say read carefully the workshops. If you're not into some of the things he's into, it may be too far out there for you. But if you can get into his basics, still very, very valuable. And there are very few people teaching the injections anymore. In fact, our NATI board, we disbanded. The liability got too great, and we said, and we were talking with the DOs still, with some of the groups, and we kind of play around with it once in a while. Said if we ever teach again, it'll be off-site. We'll do it in Costa Rica. We're not doing it in the United States. Liability on our end is too much. So it's too bad because we like teaching it. You need to be taught, but right now your options of injections is going to the DO and the MDs, and you're going to be looking at it on a big screen and watching them do it, and it's not hands-on. When we taught it, it was hands-on. We're injecting each other. We'd go by and say, where are you? I think I'm in a ligament. We'd take the needle from you, feel it, and say, no. Now, we'd put it to the proper place. Now feel that. Feel that difference. Here's muscle, here's ligament, here's a tendon. This is what they feel like. Very difficult to get that now unless you find somebody one-on-one that's willing to teach you. But to get around that of having to do any of that is the frequency medicine, and it does get there. And it amazes me how fast it is if you do it correctly. Things that I thought would have taken a mechanical fix, like central canal stenosis, when the central canal is stenosed, World War II vets and so forth, they're not candidates for surgery. If they were younger, they would be surgical candidates. I've had them where they have bilateral, not just neuropathy, but leg weakness, to the point where they were not able to function, they were not walking. And to be able to put these devices on them, sometimes in one treatment. Sometimes you never say that, but I've seen it in one treatment in several patients. Immediately got the connection back, able to walk, and it's lasting. It's been years. It wasn't placebo. I'll tell you Leo's story. The first time he was probably 86 the first time I saw him. He came in a wheelchair, and he came in because his legs were hurting him. He said, I can't walk, da-da-da-da. And that's whenever I'd first come into contact with the scanner technology. And when they came and they heard me lecture on BioEnergetic Medicine in Florida, they said, we want to tell you about this technology. And I said, okay, here's another one. Because every day, get somebody showing me something. I said, where are the studies? And they said, well, there's 780 out of Russia. It was developed for their NASA. They're developed by their space program. We've got a lot. It's utilized in Russia and hospitals and ERs. So they sent it to me that night. I read through it before my lecture the next day and was very interested. And I said, okay. So I said, send me your best trainer. And he happened to be in Australia. He's an Australian. And sent him over, and I had a lineup of 6 patients. And one was Leo, mechanical problem, central stenosis. That's pushing on that central canal. It's mechanical. What could be done, right? Some were stroke patients. Some of them were neurological problems. They had genetic disorders where they were not walking. Very difficult patients. Very, very difficult. I had helped them, but hadn't gotten to the point where I felt like, wow, there's got to be something else to help them go further. That's why they were willing to come in and let me try another thing on them, because it had more benefit with me than anybody else in all the things I was doing. But when I saw those 6 with Chris, and I saw Leo stand up, and I thought, whoa, darn, that's a pretty good placebo. You know, how's it? And then he started walking around my clinic, and I thought, how can that happen? He neurologically doesn't affect. So I knew plasticity, neuroplasticity is what had happened, but that quickly, in that age, with that kind of degeneration, with muscle atrophy, even if it's getting a neurological connection, having a hard time getting my head wrapped around that one, but I was watching him. So then he left that day, walked out, happy as could be, and I just thought, okay, we'll see, you know, keep track of, Leo, I want to keep track of you. How long is this lasting? What happened? He came back in 3 months later. It was on my schedule, and I thought, wow, that's pretty good. I wonder if he's going to wheel back in the wheelchair. How long did it last? I'll get to find out. He walked in. He goes, no, I was out in my my machine shop, and I hurt my hip. Get that Russian thing on me. And so this kind of medicine, bioenergetic medicine, is the fastest medicine you will see. It will be the most miraculous medicine you see, and it's a reminder of how amazing the human body is in remapping and finding a way when it, on mechanical and in all the things that you're learning in school, you'd say you can't get your head wrapped around it. It's this other system of medicine, this other piece of the body, that bioenergetic frequency vibrational part of the body that is the most amazing and the fastest medicine you will see. And the best medicine. It's a constant reminder to me of, wow, you know, and I think after 10 years of it, I wouldn't be saying, wow, another miracle, but I still use the M word sometimes. It's miraculous. And what's miraculous is the human body. But you're not going to see that with injections. You're not going to see that with just nutrition. You're not going to see that with all the other things. Now, you got to have the nutrition on board. That is the basic building blocks for the body to use this energy and frequency to make the repair. You've got to do all of our things that we do, but you're not. If you get the right homeopathic remedy, it can be very quick, right? Similar, but tough to get the right remedy, unless you're Stephen Messer very quickly. And as you know, it changes and you're still chasing it. They're coming in for an hour and a half to 2 hour intake. I don't have the patience for that. I just don't. It's great medicine. Great medicine. But what I have seen is that with these other kinds of vibrational frequency medicines, we're not having to think so hard. We're letting the body do it, and so that's why I'm excited about it. I wish it was part of the curriculum in the schools. I think it should be. I think it's something that in time it's bypassing us. When I lecture at International Conference of Integrative Medicine just 2 weeks ago in Ohio, all MDs and DOs. I was the only naturopath in the entire thing with hundreds and hundreds of doctors. They didn't know what a naturopath was. Guess what they're interested in? This. And we're not learning it. And it aggravates me because it fits our tenants better than it fits their tenants. We should be the forefront and the leaders in vibrational frequency medicine. I really believe that. And I hate to think that we're going to be bypassed and some other group is going to take hold of it. And it won't be us. I mean, here we are being nutritionists again. And not saying that's not beneficial. We all know it. But I'm an advocate, and I've tried. I've tried to get it under curriculum. I won't have time to teach it, but maybe some of you will take that forefront and be there and get it in the curriculum at some point and be teaching. It was probably, how many years ago? It was probably 8 or 9 years ago. I was lecturing with Zirconia laser. That's when I was working with cold lasers. And I had 2 lasers donated to the school. That was hard because they were about $30,000 a piece. Had 2 donated to the school. We trained, Dr. Nick trained, several people hoping to go forward. And now I understand that you might get a little bit of cold laser within something. I don't know. I don't know what you're getting right now, if anything. But I'm like, where's the second laser? It should be one in the clinic and one being taught here. So you actually have cold lasers here, and I want to make you aware of that. You have some expensive, great technologies right here. I don't consider it necessarily the top right now, as far as speed, the things that I'm talking about. But you have some great technologies And so maybe if you're interested, you start pushing the boat a little bit and saying, we want to learn more about this at least the cold laser, because that's a good basis to understand frequency. I am willing, and that's why when Stefan approached me, the Naturopathic Society approached me to say, would you be willing to do a weekend? I'm like, which weekend when? And that was a long time ago. We're trying to come up with some dates. I'm trying to give back. I want to get you guys excited about it and understand basics of it and know the power of this kind of medicine. So hopefully we'll be able to fill that class well enough. If not, we'll postpone it till we do have a big enough group. I've got too much on my plate to do, just a smaller group, but we're going to make it work. So, if there's enough of you that are interested, I will be willing to come and do that. We'll do some hands-on training. We'll do really in-depth lecturing of frequency, of vibrational. So, and whether it happens this weekend or not, I'm not tied to it. So I know Stefan and I talked to it, and we'll talk about it, but it'll be hard for me to come if we don't fill the boat. And I know you guys are, trust me, I know, I'm going to be a student. How much time do you have to try to put stuff together? And I appreciate all that you've done. We'll see whether it's going to be this weekend or next. We'll see. But I'm excited. I do want to do it, and I want to let you understand the vibrational body, the frequency medicine part of the body and how it works. We know a lot, and the science is there. The science is there. I have PowerPoint presentations. I've given 12-hour lectures before. 12 hours of material. Didactic, not hands-on. So I have the science, the references are there, and it is amazing. And the Nobel laureates and the people who are winning, if you get Scientific American, which is my favorite magazine, and you read that, guess where all the interest is in medicine? It's in this area right here, and that's where the physicists are there and all, and they're kind of talking to medicine, but medicine's not quite sure what to do with it, but we would know what to do with it. So I think as naturopaths, I'd love to see us take a lot bigger stand in this system of medicine, because it is the wave of the future of the medicine, as Stefan was saying. It is here, it is coming, and it will be there. Depends on, do we want to be part of it or not? And I can't imagine us not being a big piece of it, because we understand why you need the nutrition along with it, and why you need the emotional mental piece along with it, and to allow the body to make those amazing changes that can happen very, very fast. And so our bag of medicine that we've got is the perfect fit for all of this. But I want to open it up. I don't want to get into too much detail. I know you're in school and you got to get back and all that, but I want to open up some questions too. If you have specific questions on specific technologies or things that are out there that you're interested in, that I've run into, probably if it has with something to do with frequency, vibration, I'll be able to tell you about it, whether it's Reiki or those things, what I know about it, what we don't know about it, what we have science for, what we don't. I just want to get you excited and understanding that that this is where it's at, and I know that I'm talking to the ones that are here that are interested in this. So, any questions? If not, I can keep talking. I got lots to talk about. But
do you teach CME classes, and also what percentage of your practice now is energetic medicine based? Is it sustainable?
Yeah, I do a lot of continuing medical education. It gets to the point different times of year, every single weekend I'm traveling somewhere for continuing medical education. And the popular topic is, now I'll do it for nutrition companies, for Soroil, transdermal, I just did one for Soroil, I'll do about, for nutrition. There are groups that still want to learn that, and that's great. I'll bring the science and let them know that, but that to me is not the exciting piece. I do a lot, and the majority of my CME right now is in frequency medicine, because that is what they want to learn about. They know nothing about it, and they want to know about it, and they want to know the science behind it. So it's a big piece, and it's rare for me, if someone comes into pain, I know I'm going to be using frequency medicine, 100% of those patients. If they come in and their autonomic nervous system is off, if their parasympathetic, sympathetic is off, I know I'm going to be using that to balance them, because once they feel it right there in that moment, they have hope. They go, oh, wow, I feel like I'm back inside my body again. So I use it with emotional, I use it with aesthetic medicine. I'm one that, I refer to my colleagues that do Botox if my patients are absolutely set on that. I said, at least get somebody who's good at it, but when they ask my opinion, I'm not for using a neurotoxin in the brain area. That's just my intake, and I've learned to use my intuition. I'm not willing to do that because I don't feel good about it from many different perspectives, so I'm not willing to do it in my practice. My patients are saying, what do you have that's natural? What can you do? I want to fight this aging thing, but I don't want to do it with toxins and this and that. So that's what, and studying in France and Italy brought me back into the aesthetic portion of it. So between the aesthetics and the pain, a large portion of my practice right now uses frequency medicine. Some people come in, because they think they want prolotherapy, and I'm on the Get Prolo. And it's great. They come in and they've had Prolo before and it's helped them, but they're back. From another practitioner when they're back, and they say, oh, I need some more Prolo. And I'm going, need more Prolo. Unless they're an athlete and they're continually spraining and straining that ligament again, going, how long are we lasting with this? So I have, unfortunately, and fortunately, for the patients, many times the patients that are coming in for the regenerative injections, they've heard that that's an area that I am an expert in. They come in and I'm talking them out of it and getting them on the biomodulator without needles, and I'm getting the effects and they love it. So I'm getting where I'm talking a lot of patients out of needles and into frequency medicine. It's becoming more and more. There is a point in time, if they've got a loose ligament and it's very, very loose and I've got laxicity, then I am still doing my Prolo. I'm still doing that. That is an inflammatory process. Can I get there without the injection? Yes, I've done it with the frequency medicines. It can do it. It takes longer. So if I have to do 12 sessions, or I've got a patient that's an athlete, I know they need a biomodulator. I write them a prescription. They buy the biomodulator, and I teach them what they need to be doing on a consistent basis. Yeah. Okay. So yes.
What is a typical day for you at your clinic?
I'm only seeing patients 3 days a week because I do so much lecturing and I do research. I've got a research double-blind placebo-controlled study going right now with 80 patients with Vitalzyme. So I do research, and that takes a lot of my time. I do all this lecturing, and I've got a lot of other projects. So 3 days a week with patients, I'm walking in, and every day is different, and I love that. I don't want to just see pain patients, don't want to just see aesthetics. I see cancer, I see heart disease, I see everything. So when people say, what do you specialize in? I say, in health. I'm a naturopath. I see whatever walks in the door. And when they call my office and say, well, I've got rheumatoid arthritis, what's her protocol? My staff is trained to say she doesn't have a protocol. We don't believe in protocol medicine. It's individualized medicine. If you have rheumatoid arthritis, I might treat you completely different than this rheumatoid arthritis patient. So every day is different. Every day is exciting. I don't know what's going to be there. And I look on the schedule, and I've got what they're coming in for. So if it's some rare genetic disorder, I'm quickly going to look that one up. So look, and they're impressed that I even did it. They don't expect me to know it because none of the other doctors they've been to do, but they like that. So I see everything. I always treat emotionally and spiritually as well. I have found that if you don't go to those areas with your patients, you can only get so far. You can get them a great way, and they'll be doing great, but if you want 100% turnaround in your patients, you've got to talk to them about their emotional and whether they have a spiritual connection. I'm not trying to teach them some kind of my spiritual practice or anything like that. I'm just asking them if they have one. If they don't, I'm encouraging them to find something that they can connect with. So I do probably 80% consultation. 80% consultation, 20% hands-on now. And it's better medicine. I used to be opposite. I was 80% hands-on, very little consultation, but I found my best medicine is working right here and right here with my patients. Yeah.
Is there a reason you use the Tenet biomodulator rather than frequency-specific microcurrent?
Microcurrent does not have biofeedback in it. It does not. Some, yes, but show me the science and show me the research where they've done it. They don't. To date, there's not a machine that can show me that. All of it works. Frequency medicine works, whether it's a microcurrent or not. But the scalar wave and the sine wave, the square wave that they use and so forth is just, and I've used it all.
Yeah,
I
I'm
like
sure you have, that's why I'm
microcurrent.
asking.
I like microcurrent, but
yeah.
But it is faster and it's just smarter is the way to do it. That Russian technology that they came up with for that space program, I don't think there's anything out there right now that can touch it. I just don't. In my experience of working with all of it, it's the one that still amazes me. And I know it's because of that base technology. And the reason why I like the tenant biomodulators, they took the scalar technology and they made it where now yellow, orange, you know there's not enough voltage in that area. Until you get voltage in that spot, nothing's going to happen. You can do microcurrent all day long until there's not enough voltage. And sometimes it's something else that's blocking it. Then when you're done with the treatment, you're done. It shows. Got voltage negative 25 millivolts. I'm done.
It's less thinking too.
It's very,
Yeah.
it's just faster. It makes the patients, and they love it because they see. They don't just feel it, they're seeing it change. And they go, oh, that was my body. I just changed. That's powerful. Powerful. And don't ever put that patient's, that ability in what they believe. That's the best medicine you've got.
Is it expensive?
No, the biomodulators, I think it's $2,250, and that includes 4 days of training.
Oh, wow.
That's the least expensive, including training, best device that I've found. You can find scalar, the sport units, not the scalar that with your mapping and you're doing, for less, for about $900. But where you're going to get your training right now, without training, all of these devices are not going to work real well. You really have to have training and understand what they are and why you use them the way you use them.
What's the research like for treatment of cancer with the bioenergetic medicine?
Quite a bit,
Yeah.
quite a bit. In Russia, a lot coming out of there, and even in cold lasers. You get Tina Karu's book, K-A-R-U. She's the leader in cold laser, okay? She's the leader in cold laser, and those frequencies that she has used on cancer and so forth, we still use. And with tenant biomodulator, any of these devices, you can put in those frequencies. So that's not concise anywhere for you. That is you plowing in like I do through all the research that is there. Also, with the scalar technology, they treat cancer. They use it as cancer treatments in Europe. Not here. We're not allowed to say the big C word and that we treat anything with it, but yes, in Europe it is utilized.
And legally, what can we do here?
Pain management. It is FDA cleared for pain management, okay? So that includes an autonomic nervous system. So, and you know when you balance that ANS, lots of things get better. So you can say for stress, you can say for anxiety, depression, all the psycho-emotional things, but the FDA clearance is for pain management. We'll do some more studies on these kinds of things. The problem is these companies aren't big enough to fund these expensive studies that need to be done here. It's that catch-22, but they do have FDA clearance. As far as the physician, you're allowed to use it for pain management. And you as a physician can say what you want to with it because you've seen what it works on in other patients. A company can't make any claims except pain, right?
Mhm.
But physicians know. 2 more minutes? Okay. Any more questions? 2 minutes. I'll get into detail when we decide that, it looks like we've got a group to be able to do this and very much detail and teach you hands-on, let you experience the different units. I have all of them and we'll play and we'll talk more in detail as we go forward. Okay. We're good? All right.
So I just wanted to say that this is incredible training that here we're talking about one of a leading expert in this field. I can't think of anyone more qualified in teaching this to us as students because she's been through this curriculum herself, so she knows personally what our training involves and what else we can gain from it. So I've been privileged to know her as a friend and colleague and be collaborating on some studies with Duke University, etc. So I'm really encouraging you to consider this program as training here. Thanks.
But I get it. I know a Saturday is a Saturday. I get it. Trust me, it's so pretty this time of year. I was going, why did I choose not to stay? But we'll see. Thank you all for attending today, though.
Thank you.